of our fellow Australians will die of cancer this year. But what people don't realise is that when you get a diagnosis of cancer, the treatment still has to be paid for. I think a lot of people who haven't had to go through the ordeal or have a family member go through the ordeal sort of assume that if you get the diagnosis of the big C, then you get support and Medicare. And Medicare does a bit. But one of the biggest problems, in the Consumer Health Forum, experts, patients, families have made clear to my United Labor team and Catherine King, our health spokesperson, is that the out-of-pocket costs can be disastrous. Cancer makes you sick, but it shouldn't make you poor. This country, if it makes the right policy decisions, the right priorities, the right choices as a government, can prioritise helping people with the out-of-pocket costs of cancer. It is a fact that we are the skin cancer capital of the world in Australia, but in the first 2 years of treatment alone, people have on average $5,000 of out-of-pocket costs. But this morning, I was privileged to meet Sarah McGorran. Sarah's 41, she's got a beautiful little boy, George, who's 12. Sarah was diagnosed with cancer in 1996. She was told in 1996 that she only had 12 months. Well, she's strong and she's a fighter. She's clearly loved by people. But since 2001, 18 years ago, she's had to have an MRI scan every 12 weeks. You can do the maths on this. 18 years, every 12 weeks. That's 72 scans. And then, of course, there's all the other analysis that's required. That is so horrendously expensive. Whilst trained and working as a primary school teacher, there have been times when she hasn't been able to work at all. 2 incomes down to 1. She told me in a modest and beautiful way that sometimes her scans have been paid by lovely friends and family who get the credit card out just to pay for the scan. But what's even more significant is that she is not an isolated case. My colleagues and I have been overwhelmed since last night. I didn't know so many of my staff had had people in their families in the cancer fight, and some cases with tragic results. Drivers, cleaners, politicians and journalists, cameramen have all spoken to me even in the last 18 hours and said that this sounds right what we're doing. Now, Labor can afford to provide fantastic support tackling the out-of-pocket costs because we've made hard reform decisions. I know that there may be some in the government who say we're already on top of this issue. Well, we're not. Just ask tens of thousands of people paying out of pockets. Now, I can afford to make this vision for standing with people fighting with cancer because we are going to reform our tax system. These are hard decisions, but you make choices if you want to lead the country. Last night I outlined a vision, not that we can cure cancer, although we've got great medical researchers and we're going to keep doubling down on research. But last night I promised Australians, and this could be any Australian, I promised that we'll make sure your scans are cheaper, that seeing the specialist is cheaper, that the medicine is cheaper. It's exciting, actually. The proposition that we could ensure 1.5 million extra scans using the fantastic technology we have, and the cost will go from hundreds of dollars to nothing. 6 million scans we budgeted for in bulk billing. It's exciting that people can access specialists, 3 million extra consultations for free, because actually the Australian people have already paid for their Medicare system. This is the biggest step change in the provision of affordable cost of living healthcare, quality healthcare to the Australian people. And cancer, it is something which can affect any of us. Today also we're rolling out other aspects of our cancer policy because we didn't put everything up last night. We've got more good things to announce as part of our package. I'm excited to announce that we will provide $300 million in capital costs to provide radiation and other cancer treatment support right across Australia. Now, when Labor was last in government, we did a lot, but this is the next step up. As part of our $300 million, of capital works to assist in cancer treatment right around Australia. We're going to have 13 regional cancer treatment radiation treatment centres. 13. You know, in Canberra, this services the south coast of New South Wales, Yass, Bega, right along the Great South Coast. But how do we currently ask people who have a radiation treatment a day to drive hours one way, to drive hours the other way? So we're going to go around in the next 5 weeks and we're going to talk to regional Australia, because people in the bush deserve the same quality of health care. Your postcode shouldn't determine the quality of your health care. Your credit card shouldn't determine the quality of your health care. It should be your Medicare card. So I'll be down at Urabadella later today, Maria, and what we're going to announce there is the first of our 13 radiation treatment centres. Great news for people on the south coast. I've taken up enough of your time. Why don't I hand over to Catherine King, who legitimately is one of the architects of our vision for cancer treatment in this country. She can talk a bit more about some of the announcements, then we'd like to take some of your questions on this and other matters.
Thanks, Bill. Look, it's terrific to be here at Canberra Hospital today. Sarah, thank you so much for sharing your story. I've seen Sarah before. She's been a very strong voice not only for herself and her family but for cancer patients across the country, and we want to wish Sarah all the best in your continuing journey. Being here with Bill, Tanya, Alicia, Andrew, David and Megan, this is a really important announcement for the country, $2.3 billion to actually start to tackle the extraordinary out-of-pocket costs that cancer patients have been experiencing. Breast Cancer Network Australia, the Consumers Health Forum have all undertaken substantial reports telling us just what's been happening for cancer patients across this country as costs have been going up and up and up, particularly under a Morrison government that has eroded our Medicare system. We're very pleased today to announce the $300 million as part of our cancer package for capital. We're also here today announcing, as part of our Better Hospitals Fund, our $1 billion of capital for hospitals across the country, our commitment here to Canberra. $10 million for Calvary Hospital to rebuild their outpatients clinics, importantly making sure more people can get access to outpatients. $6 million here in Canberra Hospital for palliative care, because we know for some patients being in a hospital for palliative care is the best place for them to be, and we know that when they're at the end of their life they should have the best possible care, the most compassionate care they possibly can. We're also announcing $4 million for the QE2 for a post-birth centre, a mums and bubs centre. We know that many women experience postnatal depression if they've got babies with sleeping problems or with special needs, that actually having an inpatient clinic for patients is a really good way of supporting women and families in that really early stages of their lives. This is, of course, all part of Labor's investments in Medicare, investments in our public hospitals. Only Labor cares about Medicare, only Labor will invest in our public hospitals and in supporting our cancer patients.
Thanks, Catherine. Are there any questions?
Mr. Shorten, just to get some finer detail about where the money is coming from. The Prime Minister says there's an overlap in the health spending, specifically in terms of medicine. Is this all new money in your health packages?
In our cancer package, yes, it is. And the reason why we can have the big vision, the big picture about the next step change in Medicare and helping people fighting cancer is because we've made economic reform decisions. We can make this vision for helping people with their out-of-pocket costs in the fight of their lives because we've decided that as a country, I want a better deal for cancer patients and not so much tax loophole for the top end of town. It's all about priorities. You know, people will be sitting at home saying we've got the election coming up and what's the difference? Well, we are saying there is a difference. It's a difference in terms of priorities. You can vote for the existing government and they will keep the tax laws in terms of negative gearing, favouring property investors over first home buyers. That's what they say they want to do. I have a different view. I want first home buyers to have a level playing field, and I want to free up some of the taxpayer subsidy, which is inefficiently flowing to property investors in the future, and instead I want us to have a proper big picture, a big plan for helping people with out-of-pocket costs in cancer. The fact of the matter is that hundreds of thousands of our fellow Australians are paying a large part of the bill for cancer. We want to change that. We're not going to fix every out-of-pocket cost, but the fact that we can provide 3 million extra consultations, which will be bulk billed, 6 million scans using the world's best technology, and we can stop people like Sarah having to, rattle the can and rely on the love and generosity of friends. What I want Sarah to do is focus on her treatment and focus on her family. I don't want her and her family having to worry about where the money's coming from. This country can afford it if we have the right priorities.
Well, Mr Morrison claims that some of the treatments are already free in public hospitals. Is that right?
Some treatments are available in public hospitals. But, I don't want to be too disrespectful to the current fellow, but how out of touch is he? Is he saying there's not an out-of-pocket problem? Is he saying that Sarah's making it up? Is he saying that thousands of people make it? I have a hunch that even amongst the assembled media here, you will have some family members who've been hit with big out-of-pocket costs. I'm not making up the problem, but I'm offering to solve it. Mr Morrison, look, he's entitled. Yes, we do pay for some things already in our public health system, but it's not good enough. I want this country to do better.
You said this morning that you were going to release the costing of the
Before the federal election. Yeah, of course. But let's face it. I want to talk about a bit of scrutiny. This government doesn't want the scrutiny of Parliament. This government doesn't want to put the scrutiny of their... This is a very divided government, so they've got a basically contradictory critique of Labor. On one hand, they say we shouldn't be reforming negative gearing, that we shouldn't be reforming dividend imputation, that we shouldn't be chasing the multinationals to pay their fair share. They say we shouldn't be doing that, but then they also say we can't pay for our promises. The obvious point is because we're making these reforms, we can pay for our promises. I don't know if you've had a chance to look at the budget on Tuesday night, but it was a pretty colourless document, except for the fact that they've designed an underspend on the National Disability Insurance Scheme, then they've taken the money. The problem with this government is that they've made such a hash of the NDIS that they've made it difficult for packages of support to go out to people with disabilities. They haven't had to spend the money. Now they've put it in some flimsy, flim-flam surplus. We're the only major party with a reform agenda which is putting people at the centre of our decisions like we are with cancer. Sorry, I'll come to you and then I'll come to you. Well, the first question which I and my United team ask ourselves when we talk about a vision for the future, is it good for the people of Australia? Is there a problem which we can solve? There is a big problem in Australia with the thousands of dollars of out-of-pocket costs when you're in the fight against cancer. Cancer makes you sick, but it shouldn't make you poor. So we've made a decision. This is important. As Catherine said in her address to you, she said that we're the party of Medicare. We've opposed the freeze to the rebate. We've opposed their cuts to hospitals. We're putting more money back into the system. But we're not satisfied with the status quo. We don't view Medicare as a political issue to be triaged. We view Medicare as fundamental to what it means to be Australian. We view that helping people pay for their out-of-pocket costs in the fight of their life, we think that's a fundamental role of government, and it is also a cost of living issue. This is a cost of living issue. The beauty of what we're saying to the Australian people is that we're going to help you with your cancer bills and your out-of-pockets, which helps you with your cost of living. Under this government, the cost of seeing a GP, the out-of-pocket cost has gone up. Under this government, the cost of seeing a specialist has even gone up more. Labor is the only party saying we want to tackle the cost of living and healthcare costs. It's just so good for people in the fights of their lives. We are very passionate about this. We think this will make a major difference to people. I'll get Catherine to supplement it, but just if I can go to the heart of that matter. We think we should spend more money through the Medicare system to allow people to be able to go and see specialists. So we are prepared to pay more than what the system is currently paying. But we want to make sure that some specialists don't pocket the extra money we're putting into the system and then charge more as well. So we've come up with not a bad solution, but we've done it in consultation with the specialists, with the surgeons. What we're saying is that if you want to offer bulk billing to your patients, then that's all you can charge. If you want to charge something else and something more, then you can't avail yourself of the bulk billing. And the beauty of what we're saying is that patients will now have choices. If they can go to a specialist who bulk bills, as opposed to someone who just wants to charge whatever, there's now competition against the specialists who want to charge whatever. But Catherine's the expert. I might get her to unpack it further.
Thanks, Bill. Well, the current MBS item will remain, but this will be a new MBS item up to $150, which will only be available for specialists who bulk bill. So if they don't bulk bill, if they charge patients extra, then they don't get the extra money. It's as simple as that. If they charge extra, they don't get the extra money. They have to actually bulk bill in order to get this. And we have had this costed. We've had the estimates is that this will lift the bulk billing rate up to 80% from a low of under 50% currently. That's a huge amount of patients who will not be charged for their consultations. Some 3 million consultations will be bulk billed under this package.
Yeah. I hope so. I guess I'd put this point, and your question was, you've seen the Coalition cave on our call for a Disability Royal Commission. You've seen the government cave on our call to make sure that the $75 token payment for out-of-control energy bills, that people on New Start and other allowances shouldn't be excluded. You're right, we've won those arguments. Listen, I'm relaxed if the government add $2.3 billion to the bottom line of their budget. It will mean, of course, that their budget is just, going from falling apart to just changed by Friday. But, I think sometimes better off to admit you got it wrong than continue pretending there's not an out-of-pocket funding crisis in cancer. But I make the point, this government on Tuesday had a chance to announce a vision for Australia. A budget should be a map of where the country's going. It should have longitude and latitude and certainty. It should have some vision, some excitement. It didn't have that. They had a flimsy surplus based upon a structural underspend on people with disabilities when people with disabilities should have been getting that money. So the government can try and, patch up what they're doing. But I want to put to Australians on the question of healthcare. We see that as a number one issue. There's no issue more important. Who do you trust on healthcare? We're the ones who've been the champions against freezing the patient rebate. We're the ones who've called out the savage cuts to hospitals. We're the ones who want to make sure that cancer and the out-of-pockets becomes the issue. If the government thinks it's a good idea what we're saying, then why on earth would you vote for the people who didn't have the idea? Get behind us in 5 weeks, because we are going to do the right thing on the healthcare of Australians. Better healthcare, not bigger tax loopholes. Better schools, not tax subsidies to property investors buying their sixth house. What we want to do is get wages moving in this country. They have a view that low wages is good. I have a view that when your wages aren't moving, that's not so good. We want to take real action for future generations. The ultimate failure and proof of the broken nature of this government is climate change and energy policy. It's too hard for this government. Does anyone seriously expect that the same people who tore down Malcolm Turnbull because he wanted to make baby steps on climate change are going to change their stripes after an election if you give them another chance? So I characterise the difference as this. We're about a fair go for all people: schools, hospital, university, TAFE, childcare, early years education. We're about a vision to help people in cancer. This government instead wants to hang on in a reform-free way to our tax system, which has an intergenerational bias against our young, which rewards people who are already very well off with further tax subsidies. We want to use the nation's resources to lower the debt and create a surplus, which is a fighting fund for how we deal with the rest of the world's economic changes. We want to make tax reform so that we can pay for the best healthcare system in the world, the best education system in the world, the best vocational education system in the world, the best early years education system in the world. We're ambitious for the country. That's the difference. We're about everyone. This government's just for the top end of town.
The palliative care announcement, will that extend to children who need end-of-life care?
I'll let Catherine answer that.
I might actually get Megan to also supplement that. My understanding is no, that it will be an adult palliative care. I do understand there are substantial issues around palliative care for children right the way across the country, particularly improving palliative care in home, which is often where parents and children want to end their lives. But this will be an adult inpatient palliative care here. No, it's you don't have two services. You have a palliative care for older Australians, and then you deal with children in a very different way throughout the system. But I might get Megan perhaps to talk a little bit about that as well.
Thank you, and can I just start by saying again, welcome here to Canberra Hospital and the Canberra Region Cancer Centre. And the ACT government was delighted to see Federal Labor's budget in reply last night. We know that only Labor can invest in Medicare, but not only that, can really invest in the health of our community, and this is about the health of people in our community. And it's wonderful to have my friend Sarah here this morning to have her story shared with Bill and Catherine and Tanya, because her story is the story of so many people in our community. We have 2,500 new patients every year here at the Canberra Region Cancer Centre. That's 2,500 new patients. Every single one of those patients, whether they live here in Canberra or whether they live in the Canberra region, for example on the south coast or in Yass or Goulburn, this will be meaningful for them. It will make a huge difference in their lives, and that is just an extraordinary commitment from Federal Labor. We're also delighted with the announcements around investments here in Canberra, not only to match commitments that were made by the Federal Government last week, but really importantly to invest in hospital services on our north side, one of the fastest growing regions in Australia. At Calvary Hospital to expand the outpatient clinic, which will mean thousands more patients can get access to outpatient appointments and hundreds more can more quickly get onto elective surgery waitlists and get their elective surgeries. To expanding QE2 Centre, a wonderful, much-loved facility here in the ACT. And to go to your question about palliative inpatient ward, that is a very significant commitment for the Canberra community. As you'll know, we've recently had an Assembly inquiry that has just reported into end-of-life choices. That did make comment about inpatient capacity here at Canberra Hospital. We have the wonderful Claire Holland House, which delivers patient care, palliative patient care. There is a capacity at Claire Holland House to treat paediatric patients. Just 2 years ago, we funded and introduced the first paediatric palliative care nurse into the ACT, which was a really important commitment. We have here an adult inpatient palliative care ward, and we'll continue to develop our model for paediatric palliative care. But an inpatient palliative care ward here at Canberra Hospital was a recommendation of the Assembly inquiry, and we are delighted that Federal Labor will fund that.
On the PBS, you announced a change of policy last night. I was wondering, in the bipartisan approach you were mentioning on radio this morning, whether that's an admission that the government is doing the right thing with their policy and that Labor's approach has failed.
Listen, I've got a former health minister and a current shadow health minister. I think they're itching to get into some of the disinformation the government puts, so I'll hand over to them.
No, you
You've got to.
You can if you want to. Beautiful. Look, the government has so politicised the PBS. We all know that it is the responsibility of every government when the independent experts recommend a medicine for listing on the PBS that it gets listed. And that is what Labor did in government. Every drug that was recommended, we listed. Unlike, frankly, this government, there are 18 drugs that have been recommended by the independent experts that will never get listed because price negotiations have broken down and the companies have withdrawn the drug from the market here in Australia. The government has tried to make much hay about Labor's record. I'm very proud of our record of listing medicines in this country, very proud of the work Tanya did, listing some 800 medicines, $6 billion in our time in office. But not only that, setting the PBS up for reform, making $20 billion worth of savings on the PBS that has actually meant that this government is able to list drugs, but we want to make sure that there is absolutely no doubt. We guarantee that we will list drugs when recommended by the independent experts, including when they've gone through the importance of cost efficacy and negotiations on price, that we will list every one of those medicines as we did in government.
GPs and mental health advocates say it's not like people for the private care. Are you going to be announcing more of these issues?
Oh, yeah, absolutely. I mean, we've got lots of policies, and we've already made policies on mental health, and we'll be talking about it going forward. Absolutely important issue. I made a choice last night to talk about some of, not try and talk about a laundry list of everything, but rather try and talk about what are some of our biggest priorities. And what we make clear is we're up for reform in this country. We're up for real action on climate change. We're probably going to fund our healthcare system. We're going to do better in it. We've said that we will reverse all of the losses in apprenticeships, so 150,000 apprenticeships. We've said that we're a better deal for 3 million low-paid workers in terms of giving them more tax relief. So we've outlined a range of things, but when it comes to mental health, it is a top-order issue, no question. When it comes to the GP package, we didn't disagree with everything the government said. So we think that their GP package was okay, so we'll match it. When we look at their mental health announcement, we'll just match it. Like, what I'm not going to do is have a fight with the government on the things I agree on, but watch this space. We've got a bit more to say about mental health too.
Mr. Shorten, the Prime Minister has reiterated his stance on not intervening to extract the shortage from
Yeah.
Syria. What's your position?
Same position. I think if you go overseas from Australia, you're in this great country, you go overseas and join a futile and evil terrorist cause, well then it's on your own head.
But I mean, sorry, the children...
But I'm going to answer that. I understood that, but I'm talking about the parents. Can't have children without the parents. So the first thing is those terrorists who leave this country, well, I'm not having them back. When we talk about the children, they're innocent. They're caught up in this madness. What parent takes their children to a war zone? So I get that we've got to talk to the experts about the kids. We want to hear the family. So I do get that they're innocent bystanders just because of the poor decisions their parents make. So I'm not judging them, but as for the parents, no way.
On Adani, do you think in the last days before the election is called that the federal government should sign off on federal approvals? And if they did, what would be your response?
Oh, listen, when you can work out what this government's doing, could you give us a ring?
Yeah.
Well, this mob are hopeless. You got poor old Melissa Price, the Environment Minister for the time being. She apparently doesn't want to sign it. Half of the caucus don't want her to sign the approval. Then you've got a few people up in Queensland who have a different view. They want to sign it. But I just get that this is the smell of politics, not science. It's the smell of pragmatism and disunity and chaos and division rather than the long-term interest of the nation. This government, I think the nation would be better off if Mr Morrison got his driver, whistled up the driver, drove down to Yarralumla and called the election. I don't know why he's hanging on for another 3 or 4 or 7 days. Listen, the nation's ready for an election. Their budget was all about the election. We're ready, and it'll be the Australian people who decide, but this government is fast disappearing down the sinkhole of shambles. Thanks, everybody. I just want to make one last comment before we go, just to Sarah. You probably don't hear this enough, but you probably don't hear this enough. I reckon you're an amazing mum, and you just help remind us about what's important. Thank you. I'm going to try and have your story in my head every day of this election campaign. You are what matters. Thank you very much for sharing your story.
Thank you.